Ambulance services waiting times are now at record levels. Obviously not a great thing. I think though it's good and important to note that it's not the actual fault of the ambulance workers. Yes, you know, we've research finds that I think it's 83% of ambulance services in England have missed their 7-minute target. But since 2010, when the coalition government came into power, the Liberal Democrats and the Conservatives, blah, 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 the ambulance service has had millions and millions of pounds slashed from its budget. We all know, for example, there are many other factors that have come about as a result, but it's been an overall mismanagement, specifically of 12 years of Tory rule, with a little bit of help, as we've said earlier on, in the early stages from the closet Tory Lib Dems. Yeah, so I'm not surprised they're going to be striking. They've got my support. I think they'll have the support of any member of the public with intelligence. So yeah, locally, of course, what I would say is that one of the reasons for the delay, and we have got delays in Peterborough over at the Peterborough Hospital, is because not enough beds. Very, very simple. And yet, in 2010, we closed down the Peterborough District Hospital, PDH, place that I was born, many others. And I remember at the time, it was the Tories at the town hall, the same sort of Tories we've got now, who told us not to worry, because obviously I can't stress enough, there were elected councillors, members, etc., who did raise concerns about the closure of the PDH. However, we were assured not to worry because the way that the health service was working towards was a system where people were going to be looked after operations, etc., at home. Obviously, that's fine if you live in a 4-bedroom house in Wansford and you've got a cleaner that comes around every morning. But if you live in a 1-bedroom flat in Welland and you've got no family, you've got no cleaner, and that, it's not quite so good. But yeah, I think it was 300 beds were at the PDH, and as I say, closed in 2010. So that, if they'd have kept it open, would have been 300 beds on top of what we've got now, which I think is about 600 at the new Peterborough Hospital. So as far as I'm concerned, yeah, I think the only people who really benefited from the closure of the Peterborough District Hospital certainly wasn't Peterboreans. It was the developers. And so it's no massive surprise to me that what we got told 12 years ago was bollocks, and now people are suffering from the mismanagement, the poor planning of people who certainly got paid a lot of the time and are probably now retired, living on a nice healthy final salary pension.